Hi everyone, thanks so much for checking in to Skinnovate Clinic. Today I wanted to tackle a topic that's a really personal topic for me, which is hair loss in women. And a lot of family members that I have suffered from this, and so it's really become my personal mission to really find the best hair loss treatments for women. And again, in the spirit of keeping it really efficient and quick and really high yield at the same time, I want to focus on three compounds that have the most data for hair loss in women. And this is not including minoxidil. So just to take a step back, wanted to just let you know that I'm a board certified dermatologist, but this is not medical advice. You do have to talk to your in-person dermatologist or your primary care physician if you are suffering from hair loss and want a personalized plan, because your individual history would matter. And also want to say that minoxidil is one of the best studied compounds for hair growth. Don't exactly know how it works. We know it improves blood flow to the hair follicles, but it does tend to improve hair density significantly in both men and women. But let's say you've already tried minoxidil, and we wanted to understand what else can you do to improve hair loss, or the minoxidil itself is not doing enough. So I want to talk about three products today, which is Finasteride, Dutasteride, and Spironolactone. And they are all available in oral formulations that we understand really well. There have been some studies with the topical formulations, but the data is very limited. Number of studies and the number of patients in those studies are small. So essentially, most of the stuff that I'm talking about here, it pertains to the oral formulations of these medications. So let's start talking about, what is finasteride and dutasteride. They're both sort of similar sounding medications, as you might have guessed. They are basically medications that block DHT. So the question is, what is DHT? DHT stands for dihydrotestosterone. You may be familiar with it already. It is really well known in men, hair or male pattern hair loss, but I don't think we talk enough about it in women. And women, it's complicated because, you could be premenopausal or postmenopausal. Even if women that are premenopausal, you could have hyperandrogenic, or women that might have PCOS, or women that have no PCOS, but still are having early hair loss due to maybe a chronic telogen effluvium or just a genetically mediated process. But in all women, we can use finasteride and dutasteride because we do have data in both pre and postmenopausal women. And so therefore I feel comfortable discussing it, but this is something that's a lesser known fact. I don't see a lot of women coming in and talking about finasteride or dutasteride or even asking for it. So this is why I decided to create this particular video. So talking about dihydrotestosterone, it is a byproduct of testosterone. And unfortunately, women also make that. And it is probably for a good reason, but just in much lower quantities than men. So there's an enzyme called 5-alpha reductase that converts testosterone to dihydrotestosterone. And it's DHT that we understand is one of the most well-studied mechanisms where it basically attacks the hair follicle. So where the hair is coming out, there's a follicle. It makes it thinner, leading to sort of weaker, thinner hair. And also it leads to the hair follicle ultimately just disappearing. So you're going to notice shedding. You're going to notice decreased hair density, and you're also going to notice just decreased hair diameter when you are under the influence of DHT. There's also patterns to this hair loss. The female pattern hair loss is typically like widening of the part, so you'll see like more space up here. And the male pattern hair loss is, temples and then vertex of the scalp. Females can actually demonstrate signs of both types of hair loss. And that is kind of important, but I will mention to you in just a minute why that's actually critical. So moving forward, finasteride and dutasteride essentially block the 5-alpha reductase, so they prevent the formation of DHT. It does seem that dutasteride has a bigger blocking capability because it does block it in a couple of different ways, versus finasteride is sort of unidirectional. Dutasteride may even have like a slightly longer half-life, and so therefore it might be a slightly more effective than finasteride. So there are some studies, like there was a 2017 study that showed that finasteride, women that were not getting effect from finasteride, did do better with dutasteride. So if you're someone that's never been on any of these, you could potentially start with finasteride, and if you're not getting enough effect, you can move on to dutasteride. Side effects are fairly low. Finasteride is usually, so it's tested in doses from 1 milligram to 5 milligram in women. And the side effects seem to be a little bit higher with the 5 milligram dose. But what's really interesting is that men generally don't tolerate doses that are higher than 1 milligram, but women can. So, this is something that I don't see a lot, women being prescribed more than 1 milligram finasteride. Not saying you should start there, but I think we can go there if we're not getting effect from 1 milligram finasteride. And dutasteride is a 0.5 milligram dose that has been, typically prescribed, but the study and the data that we see in oral dutasteride in women, which is very, very limited, is, I think, 0.15 milligram. But one thing I just want to mention, these are off-label uses of these drugs. They're not FDA approved for hair loss, to treat hair loss in women. And most of the studies range from like 10 patients to 140 patients. So we don't have large amounts of data, but I do think that the downside is pretty minimal. One thing I'll mention is that if you have a strong family history of hormonal hormonal cancers like breast cancer, ovarian cancer, you do want to talk, endometrial cancer, you want to talk to your oncology team or your primary care physician before proceeding. And actually, in general, just need to, have a more personalized discussion about these products. So I want to take a step away and just talk a little bit about spironolactone. Spironolactone is a blood pressure medication, kind of like a fourth line, not the greatest blood pressure medication, but it's phenomenal what it does, it actually blocks a DHT. So it's not actually preventing the formation of it. The mechanism is slightly different. It actually blocks the production of it from the adrenal gland, but also blocks it from attaching to like the hair follicle and kind of causing, the hair thinning. So when you actually take spironolactone orally, it is very effective, especially for women in PCOS. So like premenopausal women with some hyperandrogenic symptoms, preventing acne, preventing hair loss. And then also in postmenopausal women, it's really effective. So the question is, if you are experiencing hair loss, what do you go with? Like, do you go with finasteride, dutasteride sort of pathway, or do you go with spironolactone? So there was a really nice study that was published in the Journal of Cosmetic Dermatology in February of 2024 that actually had showed a head-to-head trial. So basically they compared two groups. Both groups were equally matched in terms of like the severity of the hair loss, which is really important. And then they compared, 2% minoxidil topical plus 5 milligrams of finasteride, and then they took 2% minoxidil topical and 100 milligrams of spironolactone. And they follow these groups for about 4 months, and they noticed that the spironolactone plus minoxidil combination was superior to finasteride minoxidil combination, particularly for female pattern hair loss. So as you remember, that's actually the widening of the part. So the part filled in, and the hair was, it checked the 3 Ds of the endpoints that I like to think about with hair loss, which is the density of the hair, the diameter of the hair, and then the detachment, so the reduced shedding. So it kind of had, a very positive impact, and you can see that in pictures if you ever pull up that paper. However, in women with male pattern hair loss, so, that had receding in the temples and then had a little bit of the vertex showing and may even have had like a widening part, but essentially in those areas, finasteride was more helpful. So what that tells me is that you can technically do both depending on the severity and the type of hair loss you're experiencing, as on your scalp. So it really depends on your individual status. But I hope this gives you like a nice framework to at least start a discussion with your team and see which one of these treatments could be right for you. Thanks again for checking in. I'm Dr. Ketterpaul, and see you next time.